Good morning and welcome to Open Arms of Minnesota Food is Medicine. I'm April Bogard. I am the Senior Program Director at Open Arms. Today we're going to be going through some important items as it relates to the contract between Blue Cross and Open Arms. We'll be talking about what the benefit is and the referral details, how you get your members to it. A description of medically tailored meals, overall client satisfaction with Open Arms of Minnesota, the research on medically tailored meals and health outcomes, and the benefit and referral details. As you know, Blue Cross Blue Shield of Minnesota has contracted with Open Arms to provide condition-specific home-delivered meals and nutrition education to your Secure Blue MSHO members. Today, in this presentation, we'll provide you with all the details you need about the program and guide you through the steps of making a referral to us for meals and nutrition education. We're also going to share the research that's been done by some of our sister organizations around the country that shows the impact of medically tailored meals, specifically on preventing readmissions and managing chronic conditions. So who we are. Open Arms of Minnesota has been around for 34 years. We were founded in 1986 as an organization that was providing meals predominantly for people living with HIV. Over the years, we have really expanded our mission, which is to nourish mind, body, and soul. And we're now providing meals to over 1,000 clients a week who are living with all kinds of different life-threatening illnesses, including cancer, CHF, chronic kidney disease, and COPD. We have an incredibly active community of volunteers who help us do what we do. Over 7,300 volunteers came to spend time with us last year, either preparing meals in our state-of-the-art kitchen or working at one of our 5 urban farms, or actually making those meal deliveries to our clients. In 2018, we produced over 600,000 meals in our kitchen. And like I mentioned, we have 5 urban farms. We also do additional work in the community, like providing summer meals to kids who would probably not be eating because they're not in school. And so we're able to provide those meals at 2 community centers in our neighborhood. So medically tailored meals for Blue Cross Blue Shield and Open Arms of Minnesota looks like this. There are 3 different buckets that your members can fall into. One is the post-discharge medically tailored meal program, and these are for MSHO members who are discharged to home from an inpatient or short-term nursing home stay, and they are eligible to receive 2 meals a day for a period of 4 weeks. They can also receive up to 120 minutes of nutrition education as part of that program. The next bucket are the chronic condition medically tailored. So the contract with Blue Cross Blue Shield of Minnesota and Open Arms specifies that Open Arms will deliver meals to members who live in the 8-county metro area. So that includes Ramsey, Dakota, Washington, Carver, Scott, Anoka, Wright, and Sherburne counties. Mom's Meals will deliver meals to members who live in all other counties. in Greater Minnesota. But Open Arms will provide the nutrition education to all participating members regardless of where they live. The medically tailored meals program. In order to qualify for the chronic condition medically tailored meals program, MSHO members have to have a diagnosis with or be at risk for one of the chronic conditions for which nutrition interventions are known to have an impact. So that includes heart conditions, diabetes, kidney disease, high blood pressure, high cholesterol, HIV/AIDS, COPD, and obesity. In order to qualify for the post-discharge portion of the program, MSHO members need to have been discharged from an inpatient or a short-term nursing home stay within 7 business days of the care coordinator submitting the referral form to Open Arms. The members, once they have been referred to us, all of the members will receive a welcome call from one of the licensed dietitians who work at Open Arms. During that initial call, the dietitian will do an initial nutrition assessment and really try to figure out the best course for this member. The dietitian will provide information and answer any questions about their current eating, their current health, any nutrition concerns that they have right now. During that call, we'll also offer continued nutrition counseling and education sessions. So we'll be scheduling any future calls right there on that first call. And then we'll also be setting up the initial meal delivery if they live in the Open Arms delivery area. So when your members get meals from Open Arms, we deliver them directly to a member's home 1 day a week. Generally, we can deliver any day, Monday through Friday. We deliver between 11 and 2, and someone needs to be at home to receive those meals. It doesn't need to be the member, but someone has to be there to actually accept those meals. For food safety reasons, we're not able to leave the meals out on the porch or in a cooler, so someone has to be there to get them. The members are going to get their first delivery within 2 to 3 days of completing that initial welcome call. Every delivery that they get will include nutrition information and recipe ideas. And at the end of the program, so how do you make a referral? The simplest way to do it is to go to your Blue Cross Care Coordinator portal and pull out the referral form. Just go ahead and complete that form. Select which member delivery area it is. Do they live in the Open Arms delivery area or do they live in the Mom's Meals delivery area? Indicate which program the member is eligible for, their post-discharge or chronic condition. And note any dietary preferences or allergies and any delivery details. If the member lives in an apartment building and there's a buzzer, you can make a note of that. Also keep in mind the menus that are listed on that referral form are only for people who live in the Open Arms delivery area. Mom's Meals does have a different set of menus and you'll need to look at their specifics for that. You can certainly give us a call anytime, 612-677-2560, or you can give us an email, referrals@openarmsmn.org. You can send that referral form to that same email using secure email, or you can fax it to us. So why should your MSHO members participate in this program? Medically tailored meals and nutrition programs are specifically designed to support members to make sustained dietary changes to better manage their health. They're going to receive meals that have been tailored to help them manage their diagnoses. All of our menus are low in sodium, and we have heart healthy options, diabetes friendly options, dialysis friendly options, gluten free, vegan. So, clients, your members will have a wide range of menus to choose from. The nutrition education being provided by the licensed dietitian includes coaching on how to shop for healthy foods, how to cook healthy foods that really meet your members' dietary needs and where they're at. So, specifically, medically tailored meals are meals and recipes that have been developed by our trained chefs and approved by a registered dietitian. All of those meals reflect appropriate dietary therapy to address specific medical diagnoses, symptoms, allergies, the inability to chew or swallow because of medical conditions, medication management, and side effects. And we're really looking for the best possible nutrition related health outcomes. Medically tailored meals are paired with medical nutrition therapy and counseling and education by a registered dietitian. And the combination of these things, we believe, really provides the best health outcome in disease management. So, medically tailored meals at Open Arms looks like 9 different menus. We try to find a way to accommodate most preferences and the most diagnosis specific menus. So, we do have 9 menus. We have a heart healthy menu, a renal friendly menu, which is really a dialysis friendly menu, vegan, a gluten-free, dairy-free menu. Our meat and potatoes menu is sort of standard Minnesota hearty American fare. That is a nut-free menu for anyone who might have allergies. We also have a flavor neutral and a soft menu that is designed for people who may be experiencing taste changes due to medications. That's really our chemotherapy friendly meal for people who might be going through cancer treatment. We have a culturally specific menu, a Latino inspired menu. We also have a Open Arms. We survey our clients every year for satisfaction, for suggestions about what we can do to improve or do differently. I just want to go through a couple of studies that help demonstrate some of the results that we're looking for. We're hoping that we'll be able to see some of these same results. and what we're doing here. The first study comes from our sister organization, Manna, in Philadelphia, a very similar organization that does similar work. When they did this first study, they really had two questions in mind. Does providing Manna services and meals correlate with reduced expenditures, ER visits, and admission to the hospital? And do Manna patients have lower healthcare costs or better health outcomes than patients with similar medical conditions who are not receiving the services from Manna, which included food and access to a dietitian? So in this study, they chose patients who could receive 3 months of uninterrupted services. So they were delivering 21 meals a week. They were delivering full nutrition to these patients for a total of 3 months. They were all Medicaid patients, and they were specifically focused on a couple of conditions, predominantly HIV. At the conclusion of this study, what they found is that the patients who received the medically tailored meals experienced a big reduction in their monthly healthcare costs, 28%, for the 6 months after they started getting those meals compared to the 6 months before they started getting those meals. And when they compared the group that was getting the meals to people who were not getting the meals, the Manna group, the ones that got the meals, had half the hospital admissions per month as the control group. If they were admitted to the hospital, their hospital stay was 40% less expensive and 30% shorter than the control group. Their monthly healthcare costs were 31% less than the control group. And if they were discharged, if they'd been hospitalized once they were discharged, the clients were 23% more likely to go home rather than going to a rehab facility. Manna did another study with Health Partners Plans of Philadelphia, different than the Health Partners here in Minnesota. And when they did that study, they really had two goals in mind. They were looking at improving health outcomes and achieving significant cost savings. So they were looking in this study specifically at A1C levels, and they really wanted an increase in the member engagement with their care managers. So when the study initially started, they looked at 200 diabetic members. The program was ultimately so successful that they ended up expanding this to serve 1,900 members, which included their Medicare beneficiaries suffering from chronic conditions. So they expanded beyond those original 200 diabetic members. In this study, they received 21 medically tailored meals per week, which is 100% nutrition. They started for 6 weeks at a time. Depending on what was happening with that particular client, the care managers could request extensions. So they could get up to 18 weeks total, food and nutrition therapy from Manna dietitians. And then they measured the spend per member in the 6 months before. What they found was very similar to the first study. They were getting incredible outcomes for their members. So 26% of their members had reduced A1C levels after only up to 18 weeks on the program. They had 27% fewer hospital admissions, 7% fewer ER visits, 16% fewer primary care. If you have any questions, please feel free to get in touch. Our email is referrals. Thank you very much for your time today. If you have any questions, please feel free to reach out. Either give us a call or an email. Thanks. Bye-bye.